English, and basic medical vocabulary. Medical English is a specialized language used in healthcare to process communication utilizing Greek and Latin roots to form terms related to anatomy, procedures, disease, and treatments. Medically, terms are typically constructed from a word root, a prefix, and a suffix, complemented by standardized abbreviations and acronyms to ensure efficient communication among healthcare professionals. Essential components include mastery of core vocabulary, e.g., acute or chronic, benign or malignant, understanding positional or anatomical terms, vital sign monitoring, and adhering to documentation guidelines such as the SOAP format, subjective, objective assessment plan to maintain accurate and legible medical records. Second, Workbook Medicine, Formation and Association. This workbook provides a comprehensive learning framework designed to enhance English language proficiency through a structured three-pillar approach: word building, part of speech, and pronunciation. The curriculum is meticulously crafted to balance independent self-study exercises with collaborative pair work activities, ensuring both individual mastery and practical application. Furthermore, the progression extends into specialized vocabulary and context, specifically focusing on medical terminology alongside interactive puzzles and quizzes to reinforce learning outcomes and ensure the practical retention of linguistic skill. Third, simple present tense in medical record. The simple present tense is a foundational element in medical documentation, essential for maintaining clear, objective, and current records. It is primarily used to describe ongoing chronic conditions, patient habits, general medical truths, and routine procedure or prescription instruction beyond mere current actions. This tense conveys timeless facts that remains true regardless of time, requiring careful attention to subject-verb agreement, specifically the third-person singular S ending, which is critical for professional reporting. Furthermore, effective clinical writing includes the proper use of abbreviations, which would always be defined upon their first mention to ensure clarity for the reader.
4. Passive voice in medical record document. Passive voice is an essential stylistic convention in medical record document as to provide the patient the recover of care rather than the healthcare. By utilizing the structure of the verb to be followed by a past participles, medical professional can ensure their documentation remains objective, professional, and conscious, particularly when the agent performing a routine action is already understood. This approach is applied across the entire continuum of care from administration notes and diagnostic report to surgical procedure and ongoing follow-up monitoring. Ultimately, by focusing on what happened to the patient that will perform the task, clinicals maintain clear and accurate record that track a patient health history and treatment status effectively. 5. Compound and complex sentence. Sentence structure is essential for clear communication. Categories primarily into compound and complex from a compound sentence drawn from two or more independent clauses using coordinating conjunction and but so tooling relate equally ideal. In contrast, a complex sentence combination one independent clause with one or more independent clause using subordinating conjunction because outweighing to express cause, time, condition, or contract, while compound sentence focus on balance complex sentence phrase necessary context and depth, making them vital tools for patient clinic reporting and documentation. 6. The implementation of medical practice in complex sentences and medical record document. Medical process within complex sentences are vital for clinic documents as they extract and organize essential entities such as diagnosis, symptoms, treatment, and procedural details. Their sentences often embrace multi-word terminology, temporal context, and cause linked to describe patient status or clinical progression effectively. By utilizing standardized medical terminology, process uplifting and structure modifier clinical can medical on the continuous request for high quality responding directive from implementation notes and diagnosis essential to operative summary and described by 7. Short report writing of medical record. A standard medical report is a clinical document that ensures accurate communication of administrative, clinical, and legal detail between healthcare provider, insured, and authorized organization to maintain consistency and quality. This report typically follow a structured format that includes administrative detail, clinical credit details, the purpose of the report, subject and object, patient finding a clear dialogue, and a management plan. By adhering to standard template, clinical can accurately organize complex health information, facilitate better communication care, informed decision making to and complication with institute original requirement.